Hello, my name is Regina Loria-Procel, and today I'm going to be talking about disability inequity and accessibility to genetic testing and resources. So, a little bit about me. I'm a rising 12th grader at Edina High School from Edina, Minnesota. I'm a level 10 gymnast at Legacy Gymnastics. I'm an appointed student representative for my district's Legislative Action Committee. I'm part of HOSA, Future Health Professionals, and I am a Children's Hospital Youth Ambassador where I help raise money for the hospital. I'm part of my school's Global Scholars Program. And finally, I'm president and founder of my school's Latinx Hispanic Student Association. So, a little bit about my topic. Disability equity is close to my heart because of my brother. He has a rare genetic syndrome called Pitt-Hopkins. This syndrome is caused by mutation in the TCF4 gene, leading to severe challenges for him. This includes him being nonverbal and needing help for things like walking up the stairs. My brother is incredibly joyful despite his challenges, but many people globally lack similar support that he receives, making disability equity a critical global health issue. My brother has access to resources such as various therapies, special education programs, an IEP, a para, government funding, and a lot more. But not everyone has access to these resources, which is what leads to global inequity. But why is this inequity important? Well, disability inequity and inaccessibility to genetic testing impacts health outcomes, quality of life, and life expectancy for millions worldwide. According to the World Health Organization, an estimated 1.3 billion people experience significant disabilities, representing 16% of the total global population. This lack of access to resources and medical care exacerbates health disparities and poverty, which is why people with disabilities have twice the risk of developing conditions such as depression, asthma, diabetes, stroke, obesity, or poor oral health, even if it is not directly attributable to the disability itself. Specifically, for Pitt-Hopkins, globally, less than 1,200 people have been diagnosed with Pitt-Hopkins. The US has the highest number of reported cases, with 457, while India, with over a billion people more in population in comparison to the US, only has 8 reported cases. This disparity highlights the challenges faced by under-resourced countries in accessing medical resources. In Maharashtra, about 2.6% of the population lives with a disability. The true number, however, is believed to be much higher due to underreporting by census and government workers due to stigma around disability, in addition to people not having access to genetic testing to know if they even have a disability. People with disabilities face numerous obstacles when it comes to accessibility and mobility. The city streets are some of the busiest in the world, but due to India's overpopulation, it makes it incredibly hard for people with disabilities to access the city's public transportation system. According to the World Health Organization, people with disabilities find inaccessible and unaffordable transportation 15 times more difficult than for those without. This is especially prevalent in developing countries. Disability inequity is evident worldwide. And in Mexico, 41.2% of people with disabilities live in poverty, compared to 35.9% of people without disabilities. The National Institute of Statistics and Geography in Mexico reports that the main barrier for people with disabilities is the lack of accessibility on the streets, buildings, and transport. This barrier was reported by 31.9% of people with disabilities, indicating a persistent issue that limits their mobility and overall life opportunities. Disability often leads to poverty due to reduced employment opportunities and additional costs for medical care and personal assistance. This is particularly challenging for people of color who already face systemic inequalities in education, income, and employment. Research shows that race and disability are interconnected. For example, African Americans face higher rates of disability and poverty, which reinforce each other, contributing to increased vulnerability and exclusion. African Americans are also more likely to face greater challenges with their disabilities than their white counterparts. The relationship between race, poverty, and disability is what continues to fuel this extreme global inequity. Disability and poverty are closely linked, and disability can lead to job loss and reduced earnings, while poverty limits access to healthcare and preventative services, increasing the overall likelihood of health issues that may cause even further disability. Half of all working adults who experience at least 1 year of poverty have a disability, highlighting the cycle nature of these issues. In conclusion, disability, inequity, and inaccessibility to genetic testing are significant global health issues. To address these challenges, we need to increase awareness and education, advocate for policy changes, and support organizations that make genetic testing more accessible so that more people can know if they even have a disability. In order to solve this global issue, we need to acknowledge the role of intersectionality and how things like race and poverty create greater barriers for people receiving healthcare. By acknowledging and addressing these issues, we can work towards a more equitable world where individuals with disabilities, such as my brother, have equal opportunities to access essential resources, education, and employment so that people can have an overall better and more equitable life. These are my references, and I would like to thank the GHU GHLC faculty, my family, and my brother for inspiring this topic. A final thank you. And this is my contact information if anyone has any questions. Thanks again for listening.